Good morning, ladies and gentlemen. A warm welcome to another session of APAC Dialogue. Uh, and I have with us today Mr. Devanand KT of Aster DM Healthcare, the man himself, to talk about the various facets of um, Aster Healthcare and also some of his views on the overall challenges the healthcare sector is facing currently. Just before we start, a brief about APAC News Network. We are a media organization headquartered out of Noida with a pan India presence and outside India presence across Singapore, Malaysia, and Dubai. We Our primary focus is on technology deployment across different verticals, including government, healthcare, education, BFSI, manufacturing, the startup community, the SMEs, and the likes. The way we would like to start, sir, if you can first see Aster DM Healthcare, it's a very large NSA health conglomerate. So you have hospitals, you have clinics, you have diagnostic centers, you have pharmacies. So if you can first take our viewers through the structure, and then we will take it forward from there. Over to you, sir.
Yeah, thank you. Thank you, Mr. Rajneesh. Thank you so much for APAC for inviting me, for this particular dialogue. So I've been following a lot of videos by leaders, very fascinating journeys most of them have. And thank you for having me here today. So Aster, yes, has been growing. We started as a single clinic organization in 1987 from there. Our chairman and founder, Dr. Azad Moopan, he has led this organization to now, conglomerate, as you mentioned, their global organization, present in about 7 countries. So we currently operate in 7 countries and having a foothold of about 28 hospitals. And our pharmacy network is the biggest in the Middle East, Aster Pharmacy. We have recently launched Aster Pharmacy in India also. So the culture of Aster has been only healthcare. We have been focusing only on healthcare and not diversifying to any other sector or domain for that matter. And since 1987 to now, it has become a global company operating in, as I mentioned, 7 countries. With the predominant business even now comes from the Middle East business. India, cruising towards match the UAE business. But I think India business, due to the change in currency and the kind of insurance coverage that the Middle East has, it's a bigger market for Astra as of now. But there's a huge focus ever since the IPO has been launched in 2018. We are listed in India as a public limited company now. So there has been a huge focus on India business also. So there has been a clear strategy or vision document for India business with a lot of growth or expansion happening in the coming years. So all has been, because of the vision of our chairman, Dr. Azad Moopan. He's someone who has been, telling us always that, the profits is a byproduct of, health care that you give. It should not be the focus product. Basically, it should be the byproduct of the business that we operate. So that has been the philosophy. We focus on care and not the business side of it. Business will eventually follow. So that has been the philosophy. So that's the whole thing. Now, the newer modalities of newer revenue streams like the teleradiology, the telemedicine, digital health, all has been evolving. We also have launched Aster Labs in India. So there has been an integrated business model being evolved from 1987 to now. When you look at it, starting from a clinic, then expanding to hospitals, then pharmacies, then later on to newer revenue streams of pharmacy, network of teleradiology or telemedicine, tele-ICUs. So there's been a total transformation in the entire business model. So that is the in a nutshell what Aster looks like as of now.
Thanks. So if we focus on the India business, And then if you can outline to us one within the India business, um, what are the principal components? Which are the hospitals? Which are the diagnostic clinics? And more importantly, how is that integration, that business integration you mentioned? How is that? What's the dynamics of that integration?
Yeah, very, very valid question. Because the healthcare in itself is a business which is extremely complex. So to operate multiple streams, different domains coming together and synchronizing the operations is a very, very daunting task for any organization. So India, what we have done basically is to make clusters. When we say clusters, even though Aster has become a global, in India, primarily since we started from south, our presence has been from south and growing towards the other parts of the country. So we have made now three clusters in terms of geographies, I'm saying, which is the Kerala cluster, where we have a huge presence. We have a Maharashtra and Karnataka cluster operated by Dr. Nitish Shetty, who is based at Bangalore. And I'm heading the Andhra Telangana cluster, which I'm based at Hyderabad. So Kerala cluster also has Farhan, who's handling the Kerala cluster. So India now comes under these three clusters. Probably there will be another few clusters coming, based on the kind of growth that we'll have on the other geographies. Other than that, two more clusters, which is the Aster Pharmacy cluster and the Aster Labs cluster. These are the two clusters that we have in India as of now. So how all this work in sync is basically there are a lot of exchange of resources, basically, especially when labs operates in a particular geography. Say, for example, Hyderabad Aster Labs opens new labs. Obviously, we are in discussion with the lead of the Aster Lab. We also discuss on the business strategies where strategically it should be located, so that our brand equity in terms of the visibility becomes better, and it can be a win-win situation for both the hospital or the clinic in that geography and also for the labs. So hospital also support labs in terms of doing a lot of medical camps, home care services, and all. Hospital also provides that support. So pharmacy similarly has been spreading across the vertical. They also look at strategic locations to have that visibility and cover the catchments. So when in terms of that symbiotic relationship, what happens is there are a lot of resources, knowledge sharing, even patients. Sometimes what happens is that in a particular cluster there is no option of doing a particular surgery, or we don't have that expertise. Seeking that the patients are given options. Either they can move to another Aster hospital. We facilitate their movements and other things. Otherwise, the doctors from the respective hospital come to the other cluster hospital and operate. So there has been a lot of movement of resources, say, especially the transplant programs and all. A team of doctors move around the clusters and do. So obviously, there is always a give and take, and all these are aligned to the business objectives of the organization for India. So we are all aligned. All the cluster leads are aligned. We often meet every month, and then we strategize what went wrong, what went right, and what should be the way forward. So it's a combination. And there is also other vertical which I mentioned, the digital health, the teleradiology. There is another lead for that, who's Dr. Harsha Rajaram. So he also consolidates all the business leaders in establishing the tele vertical. The tele vertical, when I mentioned telemedicine is the teleconsultations or the teleradiology or the tele ICU models, which we are expanding in a rapid pace. So all these are aligned with the India business strategy, which we have. So the business leaders of each clusters, along with the pharmacy and lab vertical leads, aligned to this whole vision and mission of Aster. So that's how it is progressing now.
Thank you. You mentioned about telemedicine. I wanted to talk about telemedicine in detail. Before that, what I would like overall the technology, since you have hospitals, you have pharma, you have labs, you have diagnostics. Principally, what have been the role of technology in terms of specifically what sort of areas and what sort of technologies have been deployed in these different areas, and how they help in that integration process?
Yeah. See, I remember a meeting which happened about 10 years back. Now, I'm in Astra for the last 13 years. So, in one of the meeting, our chairman, Dr. Azad, used to always say that, OP, the outpatient, the stream of business. I would say business, the word business, which is because it's a revenue generating activity. So, the OP that happens in a hospital will vanish in next 10-15 years. This was his prediction about 10 years back. So unfortunately, it happened due to the pandemic. Pandemic has brought that kind of a total culture change where many technology experts were trying to push telemedicine in so heavily, but it did not pick up. It had to come through a disaster. That's the word I want to use. But then, whatever prediction he has made has come true. What he was suggesting is that telemedicine will evolve in India, and obviously patients with minor issues, which can be handled remotely, can be handled over a telemedicine platform. They need not come to the hospital. So obviously, when they don't come to the hospital, the OP numbers are going to crash. So that's what his thing was. So we should keep the space inside the hospital mostly for IP, where people should come to get admitted. It should not be a place where people should just come for just normal things like fever and things like. People don't have to come for admission. Most of the things can be settled at home. Now even lab comes home. You do not have to step out of your house. So obviously all those things can be remotely monitored. That's what his prediction was, and that has come true. In terms of pandemic, it is accelerated the whole tele medicine that kind of a growth that telemedicine was looking for was brought by the pandemic. In terms of, that's why I'm saying about 10 years back itself, his vision was to move towards the tele mode or the digital health mode. So we have already started about 10 years back. The movement has been slow, but we have already been entering into the tele mode or the technology mode. So now by 2022, what has happened is that there has been a tremendous progress in the technology involvement in the Aster group of hospitals. In terms of, say, for example, to give you some instances, live cases, Aster MedCity, which is our flagship hospital in Kerala, which was the first JC accredited hospital also. This hospital launched the first robotic, facility in Kerala. It also has the first robotic pharmacy, probably in India. So, this has been, we have a pneumatic tubing system in the hospital which transports materials and documents without people getting involved to transport such things. Robotic pharmacy, reduces the time taken to dispense the medicine as well as reduce the errors also. So there has been huge focus on the technology. All our hospitals are paperless. We have moved into the HIS system. And recently now we have collaborated with Oracle to move the HR functions and the finance functions to Oracle. So everything will become digitalized, from the joining formality to exit of an employee will completely get digitalized. So otherwise, a lot of documents are involved, right? Obviously, their performance appraisals, the letter issuing of letters, or any other things related to service, everything gets digitalized. So we have been embracing technology. Now, a new thing that's going to come is a product called One Aster, which is basically a product which will be focusing more on the patient side. Patient side, when we look at it, we have been also using, as I mentioned, the telemedicine, other things. But One Aster is going to make it even more convenient. It is going to provide patients that kind of an access where they'll have a lot more to, exchange or engage with the hospital. So basically, it will have, they can always make bookings. They can do a self check-in when they come to the hospital. Now, you go to an airport, you just do a self check-in, right? So even now, the patient go to a hospital, they again go to a reception and say that, okay, I have come. Then the patient file goes to the doctor. But then they can do a self check-in. All their reports come digitally. They can give their feedbacks. All education materials are customized and given in the One Aster portal. All their bills will be uploaded. So everything will become digitalized, and it will give them freedom to even chat with the doctors and ask for more doubts, and clearing all those clarifications required regarding the treatment or any other side effects. So lot more engagement of patients will come in, and to improve the satisfaction, they can give feedbacks, and then corrections also can be digitalized. So the entire patient journey from entry to the hospital to exit and even post discharge through a care continuum has been devised through the One Aster module, which is going to get launched. It's already piloted in the Middle East market. So India, it's getting piloted in few projects. So obviously, the pan India launch will happen very soon. So that's one product which is going to be one of the most unique product for Aster, which will really help our patients. And then all their documents are integrated. If they say a patient from Bangalore goes to Dubai, say for example, and get hospitalized there in any of the Aster unit, all his documents are visible there. There is no need. It's seamlessly integrated. So patients have the access to move to any of the 7 countries, and their data can be accessed with proper controls set. With the patient consent, the data can be accessed. So all those things can be brought in. So there has been total strong focus on technology, and our chairman also been very passionate about usage of technology.
Okay. I would like to know more about the One Aster, this product that you are talking about, and two, three issues surrounding it. One, this is an overall telemedicine issue. What we have seen, you have rightly said, obviously, the whole thing got accelerated during the pandemic. As you said, the OP sort of got vanished. And having said that, as gradually normalcy resumes, we have seen that the extent or volume of telemedicine, which happened in 2020 and even 2021 during the second wave, now it has come down again. And for a lot of cases, people are preferring to go back physically to the hospitals. There is also a medico-legal kind of challenge in telemedicine. We have in fact, when just the lockdown started, we had the telemedicine guidelines in India come up at that time, but there are medico-legal challenges also. Lastly, two things. Since one is when you are saying, say within India first, you have multiple hospitals and a patient can be referred from one hospital to another. So between these transfer of hospitals, there is a question of patient data privacy. So how the One Aster program takes care of that, and more importantly, as you are saying now, 7 countries. So many countries will have different health regulations. So compliance there to multiple regulations is so. All these factors, how is the One Aster product taking care of all of these?
Yeah, so 3 questions, right? So One Aster, I'll talk about the One Aster first. So One Aster, as I mentioned, is a very close product to our hearts. This has been under the development for some time, and the beauty about this product is it is not driven from top. It is driven from bottoms up. And so, see, the unit leads, the unit level team at all units have been involved in the development of this product. So, what a patient needs in a hospital is what is going to be provided in One Aster. So, what the difficulties faced by the patients in terms of, reducing their waiting time, the accessibility to a hospital, getting an appointment very easily, and also chat with the doctor in case they have a doubt, instead of say minor things, they need not to come back, right? A medicine has been prescribed. If they find some problem with the medicine, they again have to come back to the hospital, check with the doctor. So all this can be taken out. So this is one product which has been, which will also have a lot of futuristic things. The things which I mentioned are all at this point of time are readily available in other products. But now we are looking at taking it to next level. Since it's still in the product development stage, the wish list is very big for One Aster. So in terms of somebody comes to a hospital, one major challenge many patients face is the navigation inside a hospital. When they come inside for the first time, especially, they don't understand where the lab is, where the OP is, and they find it like a maze, So they move around, and even forget about a patient, staff also finds it difficult to move around a hospital for a few days when they join any hospital. So for a patient, it will be very, very difficult. So this program will also probably be, we are trying to get that indoor navigation system where they come inside the hospital, they have an option of self check-in, and the system will say that, okay, you come to meet this particular doctor, and then, okay, you are on this floor, you move and it will also give an indoor map to reach that particular location. So and if they have come for cardiology, it may also give them some push notification related to cardiology materials, the kind of disease that they have. So a lot of things can be customized later on this product. But basically, now we are starting with a few features initially, especially on the reducing the TAT, their convenience, and all data being available to them. So that's what we are looking at the first phase, and then keep on adding certain things which will come along the way. So one Aster, our feeling is that 2020, this financial, it should get launched in India because almost the piloting, everything has been done. So I think we should have the one Aster getting launched in almost all the India units. Now, when it comes to data, we are also very particular about keeping the privacy. So obviously this system will work with an OTP. That is something which the whenever a data is being, so if in the particular hospital where he's already serviced as a patient, there is no problem about data privacy there because his data is already there in that hospital. He's a patient of that hospital. So but then when they move from unit to unit, when a different unit has to check his data, the patient has to authorize through an OTP in his mobile. So otherwise, the data cannot be accessed by the other unit. So obviously, when any doctor in another unit, if he has to see the patient, obviously the patient would have gone, or else the patient would have been admitted there. So somebody will have give a consent through the OTP comes to the patient mobile. He gives an authorization, then only that other unit can access the data. So there is that control given so that no unit can check the data as per their needs. It has to be an authorization from the patient side to access the data. Similarly, when you move to different countries, the regulatory framework is different, as you mentioned. So, but when you go to any country, say for example, either you go as on a visiting basis or you are going for a permanent residency there at the different countries that you operate. But we are primarily in Middle East, so obviously the laws there are slightly different. So the system in itself, the country that you are in, gives an option. The moment you select in which country you are in, the entire program is modified in such a way it will change automatically the modality to that country. Because this was one challenge that we were facing while developing the product. So this has been brought into consideration because the regulatory framework is different in different countries. Because, say, for example, to give an instance, say, in case of a Schedule X drug or Schedule H drug in India, it can be dispensed with a prescription, and it can only be dispensed with a prescription in India, and that cannot be delivered as an e-pharmacy module. You can't deliver it at home, even though. So same rule applies in the Middle East also. So some rules are unique, some rules are uniform because some drugs cannot be dispensed over the e-platforms or the home delivery platforms. So such things, the patient has to come to the pharmacy and buy it directly with the prescription. So some rules are uniform across all these countries, but different countries, the rules wherever they're different, the moment they select that country mode in this application, it will modify the entire journey based on that regulation of that particular country. So that will be the beauty of this product.
Another important part, since this One Aster program is soon going to be launched even in India, and also earlier you mentioned about how some of the Aster hospitals have been extensively using technology, have been using robotic for surgeries, also for robotic pharmacy, which was quite a unique concept. So my question is, while technology, more and more adoption of technology is most welcome, all technology comes at a cost. And whatever way, some of the cost has to be ultimately transferred to the patients who are the. So, how to manage balance so that the healthcare remains affordable. Um, that's applicable both for the One Aster program as well as for the other usage of technology in your hospitals. So, how are you managing or balancing that challenge of
See,
affordability?
yeah, that's a very important question. That is one of the biggest challenge that every healthcare administrator has. How to optimize my cost so that the patient does not suffer. One Astra, anyway, it's going to be an app based thing. You can it's just an app without any fee. You can download it and use it. So there is nothing no charge for that for the patient. So ultimately, there is nothing passed on to the patient. But yes, in terms of robotic surgery, robotic pharmacy, and things like so, both are totally different things. I'll just explain on how we are looking at the cost on these two aspects. The robotic surgery, the advantage of a robotic surgery, why it has come is basically is to reduce the complications, reduce the number of days the patient gets hospitalized in the for a particular surgery. The wound or the it will become very micro, will not be even visible. So scars, it's almost like scarless. Even though much higher or inferior or superior to laparoscopy. And also the advantage of rehospitalization for any surgical complications. So obviously the patient gets, see, we only look at that particular instance of admission, and cost is attributed to that particular admission. But when it comes to any particular surgeries, the robotics are usually used for surgeries, and these surgeries have a tendency. Most of the surgeries, when you look at the statistics, also there is an incident of certain percentage of readmissions due to surgical complications. So and also when you do a robotic thing, you can come in the morning, probably next day you can leave the hospital, or else probably you have to stay for 3-4 days. So that cost of overstaying in the hospital for 4 days due to the conventional surgery can be brought on. And more than that, it is more of ensuring that you are getting 100% results, because it's not only manual, it is also the robotic which gives the precision. Humans, I'm not saying humans are bad, the human touch, even a doctor will only be operating that, but the precision on the accurate surgery will be much advanced than the normal surgery. So that is the whole thing. But I'm not denying that the normal surgeries are bad or something like that. It is more, see, somebody who's not willing to get admitted very often. He feels that I'll get it done once and for all, and this is anyway I'm getting hospitalized. I want to make sure that I don't get into any complications or end up in a readmission. So some people like that, and reduce the number of days inside the hospital. Such people will pay something which I don't think will be very high in comparison to the normal surgery. Why? Because we are also conscious of the market dynamics. Now healthcare has become a kind of window shopping product. It's not like past. Any doctor, for example, advises surgery for patient. Do you think now that the patient does surgery in that hospital without checking with other hospital? Never happens now. It never happens. Initial days, yes, that belief of a doctor advising something and the patient immediately obliging, that is slowly changing, because now it's more towards a consumer behavior rather than a patient behavior. They feel that a doctor has advised surgery, let me check with somebody else also before I take up. That's a good thing. Actually, you're dealing with your own life. So obviously, when you buy a mobile, you go to at least 100 reviews and check with 2-3 shops and then only buy, right? So obviously, when it comes to your own life, you are obliged to do that. So when you charge something, say for example, a normal surgery which could cost 1 lakh, if you charge 4 lakhs with the robotic arm, nobody is going to come. They will say whatever benefits you say, they will say no, it's 4 lakhs, and I will go, I will take the risk. That's how it is. So it is not that expensive. Probably yes, a 20% or 30% premium than the normal surgery will come. Obviously, the equipment and surgical skill requires a cost. Doctors have to be trained. The equipment also comes at a very hefty cost. So obviously, yes, something has to be passed on. Otherwise, the industry cannot survive and industry cannot progress. When we talk about revolutions, right? Every revolution will come with a cost. So that I think is kept at the minimum, because it's a staggered collection. It's not 1 year we have to collect back the entire thing. To the life of the equipment, that money has to come back. So that is placed in a pricing which is accessible and affordable to the patient. So that's how we usually package it, so that the patient does not get that kind of a burden. You're on mute, sorry.
And the robotic pharmacy?
Yeah, sorry. Robotic pharmacy, the advantage is that you can reduce the number of pharmacists inside the pharmacy. So there won't be any pharmacists dispensing. It's a machine. So obviously your cost has come down. So and see, pharmacy and all, you can't charge anything, right? Pharmacy is sold at the maximum MRP, so you can't charge anything. So there is nothing passed on to the patient for that. This is to reduce our cost, to improve our efficiency. So, for example, if a busy pharmacy of Aster City will have to employ at nothing less than 20 to 23 pharmacists, you can manage with the 5 or 6 pharmacists who will just manage the final counseling and other things. Balance all the things will be done. The picking, packing, dispensing, everything will be done in the pharmacy. So that takes a lot of time. Otherwise for the patient to wait and to get it dispensed. So the time is coming down. At the same time, you can reduce the number of staff, which will reduce my cost of operating a pharmacy. So that's the whole idea of robotic pharmacy. It's nothing related to the cost. Obviously, you can't pass on the cost to the patient because it's charged at the MRP rate.
So, one important thing here you mentioned about that when they're talking about the robotic surgery, the precision. Uh, Obviously, a machine can achieve that precision, but vis-a-vis the advantage in a normal surgery is a doctor also has his experience and things. But more importantly, what I would ask is, see the overall this healthcare ecosystem. There are the doctors and the other caregivers, the nurses and stuff. So all this technology deployment, unless the doctors and the nurses are not properly or adequately trained to handle that technology, then nothing can be. So how are you taking care of that?
Yeah. So that not only in Aster, most of the advanced hospitals, in terms of accreditations like NABH or JCI, has a very strong credentialing privileging formalities. Any doctor, for that matter, joins a surgeon joins with a specific skills to a hospital. After some time, what happens is that he goes through different training programs, fellowship programs. He gets trained in newer skills. He comes back to the administration, says that I've got adequate skill on this particular thing. Yes, I am certified. I've attended a particular workshop or I've attended a training, for this particular thing. So they get reprivileged to do certain things. So there's a control on whom to use, or who will be given that privilege to use. That gets annually, modified or revised. Every year, doctors have to give their credentialing privileging forms. They say that, okay, if they have acquired any new skills, they will ask for it, and then it will be approved through a particular committee and all. So that is one way. Second thing, for Aster, for people to get trained, that's a very valid question, because basically you have to get a lot of people getting trained in newer modalities. We usually send people for different training programs. Doctors or nurses are selected for training programs. Since Aster does not have a facility now for such things, we send to other parties, third parties who actually provide that simulations or skill-based trainings. But a recent development is going to happen is Aster in itself is going to start an Aster Academy, which is going to focus more on the skill development for the healthcare professionals. That will not only cater to Aster professionals, but also to other hospitals. So that is getting established. There's a person, a senior person, who's Mr. Kannan Srinivas has joined. So he has joined from a very reputed institute, and so he'll be driving those things. So we feel that yes, Aster itself has a lot of human resources that needs to be upskilled. So now we are sending them out, but we want to have our own training center and skill development center, so that our team gets trained in our own center, and even we can offer the same services to outside other healthcare players also. So that's the whole idea.
Okay. Uh, Thanks. That's interesting. Any time frame you have for that? By
Aster
when?
Academy Aster Academy should launch this year. So this year is going to be very exciting for Aster. Actually, he is based at Bangalore. He is already the strategy for that is coming up. See, this will not only have skills. This will also have a kind of mixed skill. Skill development obviously is required for any healthcare worker to upskill and to be in the industry and to continue the work that they are doing. They need that. Not only that, it will also involve a lot of soft skill trainings, a lot of management trainings, a lot of courses related to, say, for example, a nurse may be interested to move to an infection control or to an administration, there will be options for them to choose different kind of courses where they can upskill and move to different domains also. So we try to give maximum exposure to our people inside so that they can be elevated to different positions. And they are moved in different cross function also depending on their interest. So all those trainings will be under Aster Academy. We'll be also driving a lot of online courses for the other students, generally, who wish to come to healthcare. So a lot of things are being planned. So I think at this point of time, I can't reveal much because it's yet to be formally announced. So I'm just keeping my, comments reserved at this point of time. Yeah, we can discuss it at a later point of time. Or else probably you can connect directly to the Aster Academy head at a later point of time. Yeah.
Definitely. Sure, I'll do that. Another important thing for any healthcare sector in today's situation, uh, healthcare, the whole domain itself is very closely linked and has to work with two other sectors. One is pharma and one is insurance. And if you see, normally these are the pharma and insurance are sectors who are much more technology savvy than healthcare. And so, for any healthcare operation now to work successfully, how does that integration, what are those integration challenges with pharma? One, how the drugs are coming up, and insurance for any patient care now. Most patient care, that insurance and the timely payment, those are often becoming issues. So, how as a healthcare organization you are managing the seamless integration with insurance and pharma?
On the pharma integration, the scope is limited for a hospital, because we are an end user basically. So our intervention with the pharma companies are usually in terms of the supply chain management. So that has become more digitalized now. In sense, orders used to go in paper to the distributors and all. Now it has become more digital. We create a purchase order, indenting process, everything has become digitalized. So which it goes to the distributors. There is a proper vendor management system which has come in where you assign certain attributes to select a vendor, because we have seen when we select a vendor and then they fail to supply. Many times what happens is that they come saying that okay, we are distributors of so many pharma companies and all, but then sometimes they will not be able to supply. Some companies have direct supply also through their own channels. So these are the things which have moved now to the digital mode. Other than that, in terms of pharmaceutical as an industry, you're saying yes, there has been a lot of changes in terms of automation and technology in pharma industry. Most of the production units have become more automated in terms of the production, and there has been a lot of stringent quality measures which has been coming in. But I think pharma industry also is evolving with the newer ways of working. But unfortunately, the kind of molecules or the new kind of drugs that's coming to market has significantly reduced. When you look at it, you don't see such kind of blockbuster drugs being introduced in India or any other parts of the world. The number of drugs, probably COVID has been a big factor because everybody's focus has been towards the pandemic and how to come out of it. So there has been some kind of disintegration. But then the kind of new innovations or new discoveries in terms of drugs has not been very great. I would say, sorry to use that word, but then that has been the thing. So otherwise, you see a lot of new drugs coming in, new molecules getting launched, and there has been a lot of buzz. But that noise has come down a little bit. I'm not denying the fact that there are a lot of research products coming, but the number of such efforts have come down. There have been a lot of collaborations between companies, takeovers, mergers happening, and that is kind of change that pharma is also going through. Healthcare also is going through the same thing. A lot of hospitals have been taken over by bigger groups. You can see the same collaborations happening in healthcare. Well, in insurance, yes, of course, there has been a strong movement towards the digitalization. Insurance, we also face a lot of issues in terms of the data uploads. and the collection of fund and other things. So this has been, I think, noticed by the insurance company. They also have been moving towards the digitalization. So many companies have now moved into the data upload through the digital systems. They also want to move more paperless. The claim processing has been very smooth now, and the query handling, everything is digitalized. So otherwise, it used to involve so much of paper, and it used to be bundles of paper for each patient used to be utilized, and the time taken to get a pre-authorization, the time taken to settle a particular bill was a long process. But now it has become more simplified. I think insurance companies are also coming with unified platforms where hospitals need not have to use. Otherwise, if I have 30 insurance companies, I have to use 30 platforms for different companies. It becomes very difficult for the staff also to operate. So that way, this has been there has been a change in the terms of the platforms. I think companies are getting together in bringing that kind of a unified platform for claim processing and pre-authorization. So I think there is a lot more to do, because even now patients face a lot of issues in terms of claim approval, delays in claim approvals and all. Sometimes what happens, even though discharge doctor may say in the morning or in the afternoon, sometimes what we see is that by evening most of the insurance companies do not have office after 6 o'clock. So the claim processing does not happen. So we can't discharge the patient without the intimation from their side. So sometimes that gets into a slight problem. But I think there will be a remedy coming soon in terms of probably unified customer care center or being something like that's being set up by the insurance companies. So I think digitalization has definitely come into insurance, and that is going to be a very important tool also to improve the patient satisfaction and also to settle the claims faster. Just give me a second.
Aster also
Just give
had
me a second.
something.
Just give me a second.
Oh, sure.
I'm sorry about that. I was getting a call. Sorry about that. Yeah.
Aster also had something called a Second Life initiative. So, can you just brief about what is that?
Yeah. That's a very, what do you say, very recent initiative that we have launched last year, I think about 3 months back. This is something which is again very close to our chairman's heart. He does a lot of philanthropic work, basically supporting through our philanthropic arm called Aster Volunteers. We have an Aster DM Foundation, which is also a trust which does a lot of charitable philanthropic activities. So the Second Life is basically focused on children below 12 years of age who are, due to many reasons, due to non-affordability or the services not being present in some certain government hospitals, or the kind of crowd that a government hospital manages. There will be a huge waiting time to get a surgery lined up for them. So they can't live their life as it should be. So we were, thinking of an option where we could support these children by giving free surgeries at our Aster network of hospitals. So as a first phase, we have pledged about 100 such surgeries. Surgeries, when I say, these are all bone marrow transplant surgeries, or a transplant renal or a liver transplant surgeries. So it will be life-changing surgeries basically for them, for the children. So these are done free of cost at our hospital. The use of funds from Aster DM Foundation, also through the support of NGOs and other like-minded trusts or individuals. Even crowdfunding, in case the amount is so huge, we can even use a crowdfunding platform. So, but the patient, in order to pay anything, we will make sure that the patient gets the free treatment through this initiative, so that they can live their life in the to the full. And so that's why it's called Second Life. They have been living a life which is in which they are being compromising certain things, so they can have a second life where they can live their life to the fullest.
So, my last question would be if we look forward to the next 1 year, let's keep focus on next 12 months. What are, from the Aster point of view, the key focus areas? You mentioned about the academy is one part of that. But other than that, what are going to be your key focus areas, and especially on the newer front, other than whatever is going on?
Yeah, so you want the India perspective, I believe.
Yeah, primarily India perspective, but even within the overall global thing, you can mention that.
Okay. So India, we have a very huge growth plan for this year. This financial year, we'll have a huge expansion coming in. Huge expansion, when I say there may be green and brownfield projects. Brownfield projects in terms of collaborating or operations and management models, asset light models. Different models have been explored. All clusters will have more hospitals coming up under the Aster brand in India. The pharmacy and Aster Labs and Aster Pharmacy has a huge plan. Actually, the pharmacy recently, 3 days back, they launched the 150th pharmacy in India in 1 year, after launching. It was in Hyderabad, actually. 150th pharmacy was launched. In a matter of 9 months, they launched 150. So the CEO of Aster Pharmacy has a huge plan to expand in this financial year. So his plan is to multiply. At least we will have by the end of the year, his plan is to have at least 350 to 400 pharmacies in India. So it's going to be and lab also similarly, satellite labs and the referral labs are getting set up in different strategic locations. And a lot of collection patient experience centers are being set up through Aster Labs. One other thing that we are looking at is a unit called One Aster, when I mentioned, right, that there's an app. Similarly, we are also looking at a One Aster center, which will have it will be like not like a clinic, it will be like more of a digitalized clinic, where the pharmacy and lab will be there, but the consultation, everything will become more digitalized. Will be basically there'll be some places there may be a doctor, but many other places will be only a health facilitator who will connect to a nearby patient to a doctor through digital mode. So what we want to try is to bring in that, you mentioned that the digital move or the use of telemedicine has come down. It is because of two factors. One, there are even now glitches in most of the telemedicine modules. There are it doesn't provide that seamless feel or experience for a patient because we are used to see the doctors physically. So to make that culture change, it will take some time. Second thing is that after COVID, people have been devoid of any kind of human touch and interaction. Obviously, when they meet the doctor touches them and they counsel them in person. That gives a different feeling because we are used to it. So that way, when you look at it, that is why even now, in terms of the tourism, you can look at it. There's a revenge travel happening. People are just going out and traveling like anything. So similarly in healthcare, they want to now go back to the doctor. At least 2 years I've not seen my doctor physically, so I'll go and see. But then I think, like Dr. Azad said about 10 years back, the telemedicine has picked up, and then whatever the downfall that you're seeing after the pandemic spread, it will again pick up. It will again pick up to a greater extent, where people will feel that yes, there is no need for me to go. Especially all reviews should be actually online. There is no need for a patient to go to a hospital. So we should consciously drive that to the patient mind that many minor things where they need not have to meet a doctor can be settled. See, in my home, I am working in a hospital. When my mother or my wife gets sick, in first instance, I don't take them to hospital. I connect to my doctor through digital mode, get their consultation, and 2-3 days we wait. If things are better, you can avoid the visit. If things are not getting better, yes, of course, you can go to the hospital and see. So that's the way things are happening. So similarly, for Aster, this One Aster Center will try to even drive the digital initiative of India. Our country also is looking at the digital initiative. So we also want to drive from our side. And that is something which we will have on Aster centers in India. And as I mentioned, the hospital growth is going to happen. The other revenue streams, as I mentioned about the tele-radiology, the tele-ICU, the tele-emergency or tele-triaging, all these things are going to have a huge growth plan for this year. We will not only focus on Aster Hospital, we'll also be providing the services to other hospitals. Getting a radiologist in a remote area is very difficult for them to report certain things. We will have a 24 hours reporting system, there's a platform already being created for that. So all those reporting can be done, and a lot of other players who don't have that access otherwise can be plugged into this particular model. So a lot of things are going to come in this area. In terms of other digital moves, there are going to be a business intelligence, data analytics thing which is going to come in terms of dashboards and other things. Because now system gives a lot of data, but how to convert that to a dashboard and use the data to our advantage is something which we are really trying to bring in by bringing a very intelligent dashboard. So all these things are going to come in terms of the changes. Remote monitoring device is another thing that we are really looking at, especially for the chronic care patients who need support even after discharge. The doctor should get an alert if something happens to the patient while admitted in the hospital or even after discharge. Care continuum is something which we are strongly looking at. Digital care continuum. After discharge, say for example, there will be a regular follow-up of the patient, whether they are okay, they have any complications. So that follow-up on a digitalized platform also is coming up. So and more than that, Aster Academy is coming with a lot of skills. So I think this year is going to be very fascinating, a lot of growth and newer concept getting launched.
Yes, it looks to be a very exciting year. Okay,
Yes,
sir. Thanks a lot for your
thank
time. That was very detailed and very informative, I'm sure, for all our viewers. Thanks for taking out your time.
thank you
Thanks
so
a
much,
lot.
Mr. Rajneesh. Thank you so much once again. Yeah.